It is my pleasure to be here today and address this important audience. And I would like to say hello again to a very distinguished panel here at the dais. Dr. Sarin, thank you very much for giving me this opportunity. Dr. Walia, I've heard many successful stories about your leadership over years and many important initiatives that bear your name and are always quoted, so it's a great honor to be here with you today. Professor Srinath Reddy is the one with whom we struggle hand by hand and try to promote important interventions to make Indian population healthier and happier, for that matter. And I'm very pleased also to see here important people from Delhi government and Mr. Sharma and Mr. Agarwal and Mr. Jaipuria for all the contributions you have made to make this day happen today. I think it's not first time I'm in this premises, and before I give you many facts and numbers, which many of you know anyway better than us, I have come here first to bring my mother, who was complaining on some pain in the liver, and I was worried that it may be something that she has acquired here in India. She lives here in India with me, and then I suddenly discovered this institution. Of course I had some references, but nevertheless I was literally shocked how well organized the facility it is, how well managed, how qualified health personnel I met here, and how well she was taken care of for all her needs. So I think it was a great eye-opener, and I was at that time asking, how could this possibly happen in a difficult context? And then again, as we often say, where there is a will, there is a way. So yes, indeed, I think this leadership has to be commended, not only for saving some small child many years back that Dr. Sarin has so emotionally described to us as a case, as a driver for his own actions in this area. But I'm so proud to hear that, in fact, almost more than a decade before WHO woke up, let's put it that way, to raise a flag about importance of this hidden, unknown, untreated and largely unprevented disease worldwide, and then passed a resolution with support of all governments just 2 years back, and then we only have had one World Hepatitis Day so far. It was last year. So this is a really a very, very fresh and new initiative, and that's why there is still a lot that needs to be done to mobilize people around it, to increase awareness of population, to help introduce measures at policy level, at public health level of interventions that would not only prevent but also cure, in some occasions at least, this important disease. It takes away 1 million people globally from us. One would say it is not that big number. It's of course a big number in absolute terms, but compared to what other diseases take away from us, it may not sound that very big number. But we shouldn't make a mistake of that, because for example, if we talk about Southeast Asia region, it is estimated that this disease, all forms of it, will take away around during next 10 years will take around 5 million people's life away. And that is a lot, and that is together exceeding the numbers that we have for malaria, dengue and HIV AIDS. So malaria, dengue and HIV AIDS together in the next 10 years will take away, as estimated, less number of lives than hepatitis, various forms infections will take. So it is an important killer disease, but yet it is untreated, undiagnosed. And this is of course particular concern for us because it has many forms. It has 5 viruses that cause it, and today we have launched just now 2 brochures, and one may ask why 2 brochures, not of course medical personnel here, but because it was about hepatitis B and hepatitis C, and those are considered as the most dangerous forms because they are transmitted also through blood transfusion, as in the case that we have just heard here. And there are almost 240 million people who are chronically infected with hepatitis B virus worldwide, and 1 out of every 12 persons live with either with hepatitis B or hepatitis C. So it's quite widespread, as one can see. People with chronic HBV infection, that is a hepatitis B virus, have 15 to 25% risk of dying prematurely from cirrhosis or cancer, liver cancer we are talking about, as we heard in the case that was given to us this morning. And then one has to know that 80% of all liver cancers worldwide are actually caused by chronic hepatitis B or hepatitis C. So one cannot underestimate the importance of adequate measures that need to be taken to prevent these diseases. If we talk about Southeast Asia region, we are having almost 100 million people living with hepatitis B and something around 30 million people living with hepatitis C. So these are again quite large numbers. And about 60% of those people, unfortunately, are not even aware of their disease. And you know, this is a very tricky disease because it does not show its symptoms perhaps during some decades. So people don't know they have it, therefore they cannot be helped, they cannot be supported in taking necessary actions. But more importantly, and this is something which is really horrible, this is preventable. It is preventable through many various ways, but very importantly also through vaccination, which every individual at birth should get, and then until it reaches 18 years should get another 2 shots. So it is possible to prevent it. It is possible to avoid that people die from it. But yet, of course, with all other challenges combined, we are not able to reach all those people yet here in India. Well, India has, of course, largest absolute number of people infected with this disease in CRO region. However, we estimate that India has intermediate to high prevalence of its own, 3 to 4% of hepatitis B. And there are 12 to 13 million hepatitis C carriers, virus carriers, and our modeling predicts that these numbers are supposed to grow in coming years. There are also large outbreaks of hepatitis A and hepatitis E, and these are reported almost every year in India in various states, and they are mostly, of course, related to fecal contaminated drinking water consumption. And then, of course, we see many pregnant women affected by hepatitis E. So what is there that we can do to prevent this from happening? And I will use this opportunity to underline once again that these prevention strategies don't lie in medical facilities alone. They lie largely out of medical facilities, and they are largely connected to many other sectors and areas where those actions need to be taken. Now, for example, I will not miss the opportunity to mention importance of sanitation and water quality, because this is crucial for any hepatitis. Of course, certainly hepatitis diseases that are spread through unsafe water. And in India, we know that only 23% of India's rural population does have access to proper safe sanitation facilities, while in urban area we have something around 58% of people. So it's almost double, but still it is very low. And again, almost 60% of all people practicing open defecation across the world are housed in India. So that is a major challenge that India does do a lot, but does have to do more to overcome that challenge. Happily, we report that